Have you just had a total knee replacement and you're looking to get the absolute best result possible after your surgery? If you are, then this video is perfect for you. Hi everybody, my name is Will Harlow and I'm the Over-Fifties specialist physio here at HT Physio in Farnham. And today I'm going to be showing you some of the best exercises that you can use after a total knee replacement to get your knee as good as you possibly can. Now, before we dive into the content of the video, if you haven't already, please like this video and subscribe to the channel using the link in the bottom right, because then you'll be the first to hear about our new videos when they come out. And we have loads of content about total knee replacements coming up. So hit subscribe and you'll be the first to know about it. Now that that's been said, let's talk about total knee replacements. So a total knee replacement is a common but still a very major surgery that a lot of people have, typically to solve knee arthritis. So when your knee arthritis gets so bad that the cartilage within the knee has worn down, what a surgeon can do is they can come along and they can take off the top part of the shin bone called the tibia and the bottom part of the thigh bone called the femur and replace it using what we call a prosthesis. Now, the good thing about a total knee replacement is they tend to take away a lot of the pain that people have before they go in for surgery. But the bad thing about a total knee replacement is there's a very long and quite difficult rehab process after the surgery. Now, if you've just had the surgery, what you'll probably notice is that your knee is two things. Number one, it's going to be very stiff. So you're going to have trouble bending it and straightening it. And number two, you're going to find that your knee and probably the hip and all the other muscles around it are also very weak. So you can't put a lot of weight on that leg because it feels like it might give way and you don't yet trust it. So this video is going to give you some exercises that are perfect for the first about 6 weeks after a total knee replacement. So it's beginner stage total knee replacement exercises. We're going to have a look at some of the best now. Obviously, these aren't all of the exercises you should do by any stretch of the imagination. There are others that you can do too, but I've just picked out my 3 or 4 best ones. Of course, follow the instructions you get from your own physiotherapist or from your own surgeon over and above this video. If you haven't had any instructions, then this video can serve as quite a good starting point for most people following a total knee replacement. Let's have a look at what those exercises are now. So I'm going to show you some exercises that you can do following a total knee replacement. What we usually do with people who've had a total knee replacement is we start off with some exercises that they can do lying down. Obviously, after you've had your operation, it's going to be very sore. You're probably not going to want to do too much weight bearing on the knee for at least the first couple of weeks just while it recovers. So the best place to do exercises is either lying down or sitting in a chair. So I'm going to show you a select few exercises that work really well for rehabilitating a total knee replacement in this early stage process, typically the first 2 to 6 weeks really of the process. So we're going to pretend for argument's sake that it's my left knee here that we've had operated on. So I'm going to show you the exercises on this knee. You might not be able to bend it up this much to start off with. So we'll start off with the leg nice and flat. So the first thing I would ask my patients to do when they've had their total knee replacement is to reduce some of the stiffness in the knee by working on what we call knee flexion, which is just bending the knee. So what I recommend people do is on their bed at home is they start to just work on gently sliding their heel up and down towards their bottom. So you'll notice you'll have to use some of your hip muscles to lift the knee, and then you use the hamstring muscles at the back of the leg to just bring the heel up towards the bottom. And what you would do is you would repeat this anywhere up to about 25 times in a row. And what we're looking for is we're just looking to take the heel right up to the edge of stiffness. We're not going into excruciating pain, but we also do want to just slightly challenge it. So if you feel stiffness start here, you just pull another centimetre and then back down again. And you keep repeating. Now, it's normal to feel a little bit of stiffness and discomfort as you do this. That's actually quite a good sign. It means that you're working, within the realms of stiffness, but we don't want it to be excruciating pain. Okay, so it shouldn't be anything above, say, a 5 out of 10 in terms of discomfort. Now, I recommend for all of these exercises that people who've just had their surgery or recently had their surgery, they do this about 3 times a day. So for all of these exercises, about 3 sets a day tends to work quite well. So that's the first one, and that helps to limit some of the stiffness that you can have in your knee after the surgery. Now for the second exercise, what we need is a rolled up towel or a small pillow that you can use. And again, we're lying on the bed, and what we're going to do is we're going to use this rolled up towel and we're just going to place it underneath the knee that we've had operated on. And you want to have the other leg bent up just to support you while you lie down. Now, remember how I said earlier that the other thing that happens for people who've had a knee replacement is their leg is stiff but also weak. So this exercise helps to improve the weakness and gives you some more strength in your knee. So what we're going to do is we're going to set ourselves up with the towel or the pillow underneath the knee, and then we're going to try using our knee to push down into the towel whilst straightening the knee and pulling the toes up towards us as well. And when you do this, what you should notice is this muscle here at the front of the thigh starts to switch on. And then you relax. So I'll show you again. So we're pushing down into the towel, lifting the heel, pushing the knee down, tensing this muscle here, pulling the toes up, and holding for the count of 5, 4, 3, 2, 1. Relax. And with this one, again, we're going to try and repeat probably 10 times in a row. And what we're looking for is not necessarily pain, but a little bit of what we call activation to these muscles here. And these are the quadricep muscles. They're very important. They're the muscles that keep your knee straight when you stand and walk. So that's a really simple exercise just to get that muscle kicking in. Some people are amazed at how little of this they can do when they start, but with a little bit of practice, it tends to get better quite quickly. So that's the second exercise. The third one is similar. So we're going to just get rid of this towel and we're going to have the knee lying flat. Same position as before, just without the towel. Now this is another strengthening exercise that is really good for building strength here. And typically people can't do this for the first week or so. But after the first week or so goes past, they can start to do it. So you're going to start with this knee bent, okay? So the one that you haven't had operated on is bent just to support your back. And with the operated leg, you're going to pull your toes up towards you. You're going to just straighten the knee and then lift the whole leg up. And what we want is we just want that thigh to be parallel to the other one, and then we bring it back down. So we call this exercise the straight leg raise for obvious reasons. And it's a great exercise to build up quadricep strength. So the strength of the muscles at the front of the thigh. So slowly raising the leg up. We just hold for maybe 2 seconds at the top, and then we let it back down again like that. This is a fantastic exercise just for getting the strength back in the thigh. And again, with this exercise, we might repeat 10 of those in a row and try and do that on 3 occasions per day. And now the final exercise I'm going to show you in this series is another exercise that helps you get a bit more mobility and flexibility at the knee joint. So again, we're going to pretend that it's my left knee that I've just had operated on. And what I want you to do is try and find somewhere in your house to sit which has a nice high seat. Now, if you can see, I'm sitting here with my feet dangling. That's absolutely ideal. But if you don't have anywhere where your feet are off the floor, just choose the highest dining room chair that you have. So you want to allow both of your legs to hang. And you might just warm the knee up by letting it swing backwards and forwards, just to kind of get the blood flowing around this area. Now, what we're going to try and do with our operated leg is we're going to try and get it bending a bit more than we can when we just bend it on the bed using the first exercise. So what we're going to do is we're going to get our good leg and we're just going to wrap it around the operated leg. Okay, so that the calf of the good leg, the one that's not been operated on, is going to go onto the shin of the one that has been operated on. And you're going to bend both knees backwards underneath the chair. Now, when you've just had your operation, that you probably won't be able to get it back as far as me. You might only get to about here. That's about 90 degrees. So what you're going to do is you're just going to use your good leg to pull your bad leg back into resistance and then hold. So you go back, hold, relax. Back, hold, relax. Back, hold, relax. Now, doing it like this is better than doing it and holding it, because we're not looking to stretch the muscles necessarily. We're looking to break down some of the scar tissue inside the knee joint. And I found from experience that the best way to do that is through repetitive movements rather than just holding it in one position. So what you would do is you just pull it back and relax, pull it back and relax. And usually for people, the best way to do this is to try and spend about 2 to 5 minutes per day doing that. And you can do it all in one go, or you can break it up throughout the day. It tends to probably work better if it's done in separate sessions, because then you get kind of a recovery between them and then you can go again. That tends to work a bit better. If you prefer to get it all done within the morning or something, that also works well. And you just keep it mobile, you keep it moving until you feel that you can get your knee a little bit further back. With a few days of practice, undoubtedly, you'll have more range of motion at the end. So those are some of the best early stage exercises for people following a total knee replacement. I hope this video has made sense and that you've enjoyed watching this video and having a go at home. Anyway, that's all I've got for you today. If it's been a helpful video for you, please leave a comment below. I love reading the comments from people who watch the videos. And if you want more from me, then please pick up a copy of my book. It's called Thriving Beyond 50, and you can find it on Amazon using the link below this video. Anyway, that's all I've got for you today. Thank you so much for watching. I appreciate your time. And I look forward to speaking to you on the next video.